to our April 28th Douglas County Board of County Commissioners business meeting. We want to welcome any of you who are at the Douglas County Courthouse or joining us online. I just want to pass on a bit of information regarding how we'll run meetings on Zoom during this time of social distancing. If visual aids are used during the meeting, the presenter will share their screen with the call. Participants will not be able to view them without a computer, smartphone, or tablet. All participants will be entered into the meeting with their audio muted, meaning the commission and the public will not be able to hear you. Presenters will be unmuted when their agenda item comes up. We ask that all online presenters use good conference call etiquette and mute their line when not speaking and introduce themselves each time they speak. If you have a public comment on an agenda item or under regular public comment, please use the raise your hand function on Zoom. Staff will call on you and unmute you. We ask that speakers give their name and address for the minutes. The county reserves the right to shut off the microphone and remove any speaker from the meeting if they are vulgar, rude, or inappropriate. A recording of this meeting will be available on our website after the meeting. We will start with our consent agenda. Would either commissioner like to pull anything from our consent agenda?
No, thank you.
Nope.
Sarah, is there anyone at the courthouse who would like to pull anything from the consent agenda?
Hold on just a minute. What item would you like to remove?
Whatever one of these, I might be a week late, but extension of mental health.
That's not on consent, so that's on action. It's on the action agenda, so it's not this part of the agenda. No, we have no one here to pull anything from the consent agenda.
Thank you.
This is Commissioner Reed. I'll make a motion to approve the consent agenda.
Second.
All of those in favor, please say aye. Aye.
Aye.
Aye.
Thank you. We will move on to our general public comment. Just a reminder for folks, if you have a public comment about a particular item, please wait for comment for that action item. If there are general public comments, we will take them now. Sarah, is there anyone at the courthouse for general public comment?
Yes, we do have someone here for general public comment. You want to come forward and sit here at the table and state your name and address for the record.
I'm going to speak loudly, so try not to be offended by how I speak. And it's Shannon. I know Shannon. We went to school together, or mostly. Anyway, I didn't know you were on here. That's awesome. I haven't been here for a few months, but
Can you introduce yourself?
my name is Eric Hyde. My address is 1605 West 27th Street. I'm happy to see two new faces here. It's awesome. Since I was here last time, I came a little bit unprepared. I've been very busy, but I just want to say that I think you should change the title of this session. Instead of labeling it business meeting, I think you should label it public meeting. Because we're not only focused on business, we're focused on the public here in the county. And I appreciate that your work session is open to the public. You're following the rules that way, and I greatly commend you for that. I do know a lot of Kansas laws. So let's say, I'm going to try to keep this short because for time limit, I have been helping the homeless a lot, but I kind of quit that. They did assault me on April 4th, 2021 with an aluminum bat. They hit me 3 times in the head. Shannon knows that I have a traumatic brain injury that I received when I was 8 years old here in Lawrence. Surprisingly, I didn't lose any consciousness. However, right now I still have a fractured spinous process of my C6 vertebrae. There's not anything they can do about it besides ibuprofen until it heals. I just want you to know that I think homeless people have the right to be in Lawrence. However, I do not think they have the right to be in city parks at all, or in the county, really. for extended periods of time because they can dirty their campsites and cause any other, I believe they have human rights and we shouldn't disregard that. As far as along the river, I know that there are recreational rights below the high water line and people can camp there. However, I think that there's probably some statutes you can look into to see how long they can camp along the river without sort of trashing the area. And that's where I was assaulted, by the way, on April 4, 2021, was by the river, by the bridge in that open space, by that utility gravel road that goes off of 6th Street in between Kentucky and Tennessee. So I just want to say that also I'm not mentally ill. I just have a traumatic brain injury and I do have a governmental waiver and I'm going back to school for free because of this waiver. And I also, it's amazing. It is so amazing. I'm also running for Lawrence City Commissioner as an independent because I'm trying to unite Democrats and Republicans instead of separating our views, try to appreciate our differences and try to bring us together like a circle, all on the outside looking at the middle. Anyway, that's all I wanted to say for now. Thank you for listening.
This is Commissioner Portillo. Thank you, Eric. Sarah, do we have anyone else for general public comment?
Not at the courthouse.
Jill, do we have anyone online for general public comment?
No.
Thank you. We will move to our first regular agenda item 3.1 from the Planning Department. Consider revised site plan for SP 20-00451. Do we have a presentation for this item, Sarah?
I believe we do. I think we're moving folks into the meeting.
Yes, I've moved Mary Miller and Joy Ray into the meeting. They should be, there they are.
Good evening, Commissioners. I'm Mary Miller, City County Planner, and I'll be sharing my screen. You may recall this site plan was before you in February. You approved it, and as they were doing their construction plans, they discovered there were some changes they needed to make. And these changes were significant that the site plan is being returned to you. The zoning regulations do allow the planning director to administratively approve very minor changes, but these are more significant. This property, you may recall, is in the southwest corner of the intersection of US Highway 40 and East 1500 Road. And this is for the agricultural equipment and farm implement service repair business that was going to be located there. There were a few conditions placed on the site plan when it came before you that have been met. One condition was that the land combination that's going to increase the size of this parcel from about 1 acre to about 2.4 acres would need to be completed before we could release the site plan. And that has been completed, and the book and page number are noted on the site plan. Another condition was that the right-of-way needed for East 1500 Road to be dedicated before the site plan could be released. And that is noted on the staff report, but that was completed after the staff report was published. So that's also a condition that has been met. This shows the layout as it was approved in February. The red numbers indicate the 2 buildings that were going to be kept of the airport motel buildings. This was going to be an office, and this was going to be for outside display. The blue areas were the outside display areas. The yellow area is marked because that's the parking area, and that's being revised with the updated plan. I just wanted to highlight that. And also, if you'll notice, the access point was about 8 feet from the southern property line, and that's also being revised. And so this is the current plan as revised. There's no buildings being kept. So the display area will be increased, and this will change the impervious surface coverage from about 21,649 square feet to 16,519, which is a reduction of about 5,000 square feet. And at the meeting, the commission indicated or added a condition that they include stormwater management measures on the site. They worked with the county engineer, and in the southwest corner, they do have a detention pond that's been installed. And so this pond plus the reduced impervious surface should be able to adequately manage stormwater on this site. They were going to use the restrooms in the office. Since that's no longer going to be used, restrooms will be included in this building. It's a 4,800 square foot building that they had been planning. And so they're relocating the septic system. It's here now. It'll be relocated here. And the health department approved that, but noted that the existing septic system had to be pumped and crushed and vacated, and that a new septic permit be obtained for the new permit before certificates of occupancies are released. And that is one of the conditions noted on the staff report. And then the access point, as you can see, it was 8 feet below 4, and now it's about 34 feet from the southern property line. As they were doing their construction plans, they realized there was a utility pole here they wanted to avoid. So they met with the county engineer, or they provided plans, and the county engineer indicated that was acceptable. And this shows the revised parking layout. Before it was more square. They have it angled, but we still have the required width for cars to get through safely. And so with these changes, staff recommends approval of the revised site plan, subject to the condition in the staff report. And the only condition that remains unmet is the provision of the lighting spec sheets, showing that the LED lights will have a color temperature of 3000 K or less. And I'll be happy to answer any questions if you have any. And I believe the applicant is present today as well.
This is Commissioner Portillo. I don't have any questions. Commissioners Reed, Commissioner Kelly?
No questions.
This Commissioner Reed, I just have a curious question, which is what the decision behind why get rid of all the buildings and choose to build a new. So just curious.
I believe Joy Ray, the applicant, is here and could answer that.
I will try. My internet seems to be going in and out. But Joy Ray with Paul Werner Architects, they had started to look, and we've done plans to revitalize those existing buildings. But once they got to looking at cost, it was double the amount to fix the insides of those buildings than it was just to tear them down and build a new one.
That was my hunch, without having seen the interior of the buildings, figuring it was a big project. So thanks.
Yeah.
I don't have any other questions. Commissioner Portillo.
Thank you, Commissioner Reed. This is Commissioner Portillo. We will open this item up for public comment. Sarah, do we have anyone at the courthouse for public comment on this item?
Nope, we have no one here to talk on that item.
Thank you. Jill, do we have anyone online for public comment?
No.
Any additional discussion by commissioners?
The only thing I would say is, Mary, I think if my calculations are right, this is actually less impervious surface than they had before. Is that right? I mean, prior, yeah, Joy's saying, yeah, that's yay, right?
Yeah,
For
it's
that
being
area.
reduced now, yeah.
Yeah, I mean, but it's even less than what they had prior to building on it. It looks to me. I mean, I think I have 6,000 square feet of building space before. So we don't need to, I mean, I don't know that we need to discuss. I just found that interesting. I was just calculating that up, like how much less is this? So yeah, sorry.
I'm happy to make a motion. However, I need to go pull up the right language. Which, if either other commissioner has it pulled up, feel free to jump ahead of me.
I can do it real quick if you like.
Go for it.
I move that we approve the revised site plan SP 20-00451 for equipment sales and services, light heavy equipment sales and rental, light and heavy equipment repair service, and farm implement repair service on approximately 2.41 acres at 1493 Highway 40.
I'll second that.
All of those in favor, please say aye. Aye.
Aye.
Aye.
Thank you. We will move to item 3.2. Public Works, consider a Lecompton Township request to establish minimum maintenance designations on 3 roads. Sarah, do we have a presentation for this item?
I believe we do. Chad Voigt and I believe Kevin Sontag will be moved over. Chad, is that correct, Kevin?
That is correct. I'm going to let Kevin take this one. Thank you.
Jill, can you move Kevin over? I don't have access to do that on this different laptop and Robin's. Okay, thanks.
Can everyone hear me? All right, good evening, commissioners, to those watching on Zoom. My name is Kevin Sontag. I am the Douglas County Surveyor. Lecompton Township has made a request to establish minimum maintenance designations on 3 roads in their township. Kansas statutes give the power to establish site designations to the Board of County Commissioners. The 3 road segments in question should be displayed on your screen now. All 3 of these road segments are very similar in nature. They were all opened over 100 years ago as public full maintenance roads. As far as anyone can remember, and using older aerial photography as visual evidence, all 3 were maintained and travelable until around the 1990s. Around that time, these 3 roads stopped receiving regular maintenance as it was not necessary for the general traveling public, and no residences took their access from these segments. Currently, all 3 roads are in such poor condition that a regular car could not traverse them. They are only used today by people walking, riding all-terrain vehicles or horses, or not used at all. They are not officially minimum maintenance roads, but they have every appearance of being one. The township has no desire at this time to improve these roads, and therefore are asking for the minimum maintenance designations to match their current physical state. On April 20th, at the regular monthly township meeting, the Board of Highway Commissioners of Lecompton Township held a hearing and accepted public comment on whether they would recommend to the Board of County Commissioners that these roads become official minimum maintenance roads. No member of the public present at the meeting voiced any opposition, and the township officials voted unanimously to recommend that these roads become minimum maintenance. Their certificate of opinion offering this recommendation is in your agenda packet for this item. The next step requires the Board of County Commissioners to officially, by resolution, commence the process to establish the minimum maintenance designations on these 3 roads. If the board approves this resolution tonight, the item will be presented to the Lawrence Douglas County Planning Commission, where they will hold a hearing and ultimately offer their recommendation as to whether the designations should be established. After the Planning Commission offers their recommendation, a final hearing will be held by the County Commission to take public comment, and if appropriate, enact a second resolution that officially establishes the designations. At this time, I would be happy to answer any questions you might have. Thank you.
This is Commissioner Portillo. Thank you, Kevin. I don't have any questions at this time. Commissioner Kelly, Commissioner Reed?
Nope.
No.
Okay, we will open this up for public comment. Sarah, do we have anyone at the courthouse for public comment on this item?
No public comment on this item. Thank you.
Thank you. Jill, do we have anyone online for public comment on this item?
No.
Thank you. Any additional discussion? Commissioners Kelly, Commissioner Reed?
No. I can
No.
go ahead and make a motion if nobody has any more comment.
Go ahead.
I move that we approve the request to establish minimum maintenance designations on 3 roads. Wait, let me start again. Erase that. I'll start over. I withdraw my motion. I will make a motion to approve the attached resolution that officially commences the process of establishing minimum maintenance designations on 3 roads in Lecompton Township and requesting a recommendation from the Lawrence Douglas County Planning Commission.
I'll second that.
All of those in favor, please say aye. Aye.
Aye.
Thank you, commissioners.
And with that, we will move on to item 3.3, Integrated Crisis Team Expansion Contract. Sarah, I believe that we have a presentation on this.
Yes, commissioners, we do. I think we're going to move everyone into the chat, into the webinar, and I'm going to turn over the presentation to Bob Tryansky, our Director of Behavioral Health Projects.
Thank you, commissioners. Give me 1 second. I would like to, and I'm going to cross my fingers. Let me ask this question. Are you able to see these slides if I don't put it in presentation mode? Okay. I'm going to
Yes, we can also see the slides that are coming, but that
Yeah.
just gives us a little preview. So
Okay.
I guess.
Terrific. I am excited we're so excited to come to you and have this opportunity to share what we hope is a final contract with LMH Health to move forward with the expansion of the integrated crisis team. As we've discussed beginning in March of last year, about a year ago, the members, the partners in the integrated crisis team, LMH Health, Burt Nash, Heartland Radak, and DECA, started working directly with Derek Hurst, the director of the integrated crisis team, to begin planning for this expansion to being able to offer true 24/7 crisis coverage in the emergency room, to begin working together with Burt Nash to flex staff between the access center, to extend the access center hours Monday through Friday from 8 o'clock to 8 o'clock, to take the steps forward that we need to accomplish a couple of goals. For those of you who are not familiar with the work we've been doing over the last 3 years with the integrated crisis team, the idea began in 2018 to try to improve the patient experience and care in the emergency department by embedding behavioral health professionals and peer specialists in the emergency room, by improving access to community-based and regional substance use services, by connecting people after a crisis with the opportunity to navigate with a care coordinator in the community for 30, 60, or 90 days. And those care coordinators would work with clients after a crisis in the emergency room to reduce barriers to care, to close equity gaps, and to work in an integrated way to collect and share data. We keep using this phrase, we want to provide the right care in the right place at the right time, and we're trying to find the right path to get from where we were starting in 2017, when the County Commission made a significant investment in putting pieces in place as we move toward bringing the recovery campus online, to build that crisis continuum and that system of care that moves people from crisis and illness as a norm to recovery and prevention as a practice. So this proposal, which was shared in multiple study sessions and proposed through the budget process with a budget not to exceed $466,000, has gone through several iterations, but always focused on kind of four primary focuses. Number one is to build the workforce, that interagency multidisciplinary team that we are going to need to staff the crisis center, to expand access to care so that we can spend more time in the community before somebody would need to visit the emergency room, to integrate peers throughout the system of care. We have substance use. We have peers in the emergency room now who are working 7 days a week, 8 hours a day. We also have certified peer specialists on the mental health side who are supplementing those hours. So we've achieved that. And Derek and his team have done a tremendous job of sort of gathering and sharing data that, as I said during the study session, I think we're really in a point now where we can start to analyze and synthesize, do some sense making, and what are we learning through the work that's happening. In a lot of ways, this expansion sets up what we are very hopeful will manifest itself in some additional mobile response opportunities when the Burt Nash Access Center, the Crisis Center's Access Center portion of the building is not online, to provide coverage and support over the weekends. This is obviously something that's going to have to be well coordinated over the next year to year and a half with the emergency department, because we will still have people in crisis going to the emergency department. So all of this kind of manifests itself into a plan to expand the 4 FTE of the integrated crisis team to a 9.8 member FTA. I think I'm adding that up right. I don't have my notes in front of me. So it's to add 1.9 crisis clinician, another master's level qualified mental health professional to the team. 0.2 FTE will support the access center. 0.2 FCC, 0.2 FTE will cover the ED, and then some additional support in the form of crisis clinicians who would be able to provide swing shift coverage between Burt Nash and LMH. A crisis case manager, an ICT supervisor to back Derek and his team up as we go 24/7. There's just a need for more supervision, and to be able to be prepared as we move toward the mobile response. Hopefully, what would be, be ready to do that, so that we would have the leadership in place to be able to make progress on that project as quickly as possible if there was approval by the commission as we move through that process. So that is the proposal, and as I said, it's really the framework is no different than we shared with you 6 months ago in October. What's different now is we finally have a contract that is a community partner agreement between Douglas County and LMH Health, with some more specific reporting requirements than this team has had before. And, as you've seen, you've had an opportunity to review the contract, some real detailed deliverables and expectations for this project and LMH's role in it. I just asked if I could kind of walk through that to give you an overview quickly, because the commission that approved that budget is a different commission than we have now. And I wanted to make sure that we have an opportunity to orient you to this and then really open it up for questions. Derek Hurst, the director of the integrated crisis team, is online from LMH Health. And then Stephen O'Neill, Chief Operating Officer, and Jeanette Kirkpatrick, LMH Vice President for Clinical Excellence, are on the call. And I'm going to step back and allow you to take any questions you feel would be helpful.
This is Commissioner Portillo. Thank you, Bob. I really appreciate that introduction and overview. You mentioned that we now have a contract that lays out more specifics as far as what we're going to measure, what kind of data we're getting out of this. Can you just help me understand what specific outcomes are we looking at measuring, and how is this contract different than how we originally conceived it? So what are the additional points of data that we're collecting?
Derek, do you want to speak into that a little bit and share some of the metrics we have been tracking for quite a while and now are prepared to be a little bit more public with the
Yeah, I'm happy to. Thank you, Bob. So for the last, about 3 years since this team kind of came into existence or started to come into existence, we've really been spending a lot of effort in looking at the data that we have around around the patients that come to the emergency department in need of behavioral health care, or especially crisis behavioral health care, as we kind of look forward and make plans for crisis center and other crisis continuum services. And so we've learned a lot of lessons in those last 3 years, and have really been able to tweak that data to the point where we're pretty confident in the accuracy of that data, and also in how it can help us make more real-time decisions by having it more accessible in a quicker way. And so one of the commitments we've made is actually supplying a behavioral health dashboard to the county on a regular basis, so that the county has regular updates about that same information that we've been kind of looking at and combing through for the last several years to ourselves, to really kind of see, how are these resources, how are these interventions that we're putting into the community, how are they affecting, the folks that we're seeing coming into the emergency department or the LMH setting for those needs. And so that's one of the specific pieces about that data that we're committing to, and that really helped us, make a lot of positive decisions. And then also we use that data as we set up this proposal, we had used that data to really identify, when are the high needs, high demand times for individuals in our community, so that we can really, put scarce resources where they're going to do the most good. And that's really kind of how we've developed some of these positions and identified where they need to be in that place. And so, we're obviously continue to monitor patient waiting times in the emergency department around behavioral health issues. That continues to be a high priority concern for us. And so that data, will be available to folks, through this project and through this contract so that folks have an idea about what's going on and how these interventions are affecting change.
From the county
Did I answer that?
perspective, I think from the county perspective, some examples of ways in which this has been helpful is I think it's established some of our baseline assumptions of what our volumes might be in the crisis center. We have a much more specific understanding of average length of stay broken down by those individuals who go home, those individuals who go for a voluntary placement in a hospital setting or an involuntary placement, because there are disparities in terms of experience for people who are in the emergency department. We have a clearer sense of where some real opportunity is to bring some focused attention and to continue to improve quality. So, I would say that the work that LMH has done in that realm and their capacity for that continual quality improvement is something that has really benefited our whole team of partners, because it allows us to have conversations informed conversations and discussions about how we do better and whether or not we're making progress with populations that we need to pay better attention to and bring better care to.
This is Commissioner Portillo. I really appreciate that. And I appreciate the comment about, I appreciate that you're using the data to inform your decisions, because I think we oftentimes collect data and then just kind of let it sit there and collect dust. So I appreciate hearing exactly how that's going back into decision-making and into that management model. You did mention a dashboard, and I saw kind of the dashboard as part of our report in our agenda that we were reading through. We just received a really wonderful report about the dashboard from the sheriff's office that's going to be living in part of the CJCC hub. So I understand where the dashboard we talked about last week lives. Is there a place where this dashboard and these data would live that would be public facing? Is that something we want or need, or is this more of an internal communication?
So at this point, it's internal, but when I say it's internal, it's shared among the partners. And the stage that we're at is public health and KU have been working very closely to create a data sharing repository. And we have just concluded the business use agreements and the data sharing agreements among all of these agencies, and we're testing now. So what's happening is, like Derek's team is submitting the ED data to that repository, and all of the partners can access those reports. Same is true with Bert Nash, who they are giving us tremendously more robust data and stuff under the hood for related to access and psychiatry and all of those pieces. So where we are in this process is we are this year putting all of those reports onto the repository instead of having them come to the county, so that we could start to look at what it would take to, and which metrics are important to elevate from the dashboard. There's a lot of in the weeds data there that I think might not be all that helpful for the public to have to weed through. But some basic things of what's the average length of stay, how many people a year go to Osawatomie, how many people are we able to keep in the community? Those sort of metrics, I think, are going to show up at least on the My Sidewalk platform for public health, for example, as we speak to progress on the behavioral health plank of the community health plan.
Thank you. Those are all of my questions. Commissioner Reed or Commissioner Portillo or Commissioner Kelly, do you have any questions?
Commissioner Reed here. I'm curious about what we're talking a lot about the work and the training and the agreements that are being done amongst these community partners, and that a lot of this work is happening now because it's informing how we stand up the crisis center. I'm curious about what training or communication might look like with other community partners as this integrated crisis team is expanding. And so thinking about law enforcement especially, and that is a particular conduit, if you will, in which people wind up at the emergency room and referred perhaps for crisis intervention. So I'm curious also about like just if there are other community partners such as headquarters, Heartland. You know, I know that the care center has some relationship already with the emergency department in terms of their response to certain cases. So thinking about kind of other community partners that do some of that crisis intervention work and whether or not there's any cross training that's happening there. But mostly I'm interested in what communication and or cross training might look like with local law enforcement in terms of their awareness of this team and how referrals might be made, or just anything you think is, I guess, worthwhile to speak to about kind of, that's a common conduit for people who are experiencing crisis and have first contact with police for one reason or another, and police are who transport them to the emergency room. At least that's my anecdotal experience. So if I'm off base, anybody at LMH, please tell me.
Yeah, so we are working really closely with law enforcement on a daily basis to communicate about potential needs for community members that are coming into us. You know, whether that's just individually with a law enforcement officer as they may be helping escort somebody to the emergency department, or may be providing collateral information about what has been going on prior to them coming. And so I would say that it's pretty safe to say that the law enforcement agencies do have a pretty good knowledge of the team's existence and what we do and how we do that. We did over the last few years to kind of go and do some different presentations with different groups around what this team does and why we're existing in the emergency department and what we're doing. And so there is a lot of collaboration and work that's occurring there. We also, as part of the CIT training that the police officers are going through as well. We have an ICT section, or have historically had an integrated crisis team informational session during that training. So they get to see pictures of the emergency department and the space that we're using for our behavioral health preferred space in the emergency department, and a little bit about what we do too. So we are trying to educate and work more closely with law enforcement and trying to figure out how do we make this process more smooth for primarily for our community members, our families, our friends that are coming to the emergency department, but also when law enforcement is involved in those interactions, how do we make sure we're communicating effectively and getting the information we need to help identify with the patient the next best steps.
You know, there's one other thing, Commissioner Reed, that I think is interesting, and it was one of the things that Derek did at the outset of this project, which was, you know, we've got kind of 4 or 5 core members that are participating in building this integrated service delivery system. But Derek also convened and built a clinical huddle team that was meeting weekly when we started this. And it was all of those partners you talk about, Willow, the care center, the shelter. It's a table of about 15, 20 people that were meeting weekly to share what they do, and for Derek and the team at LMH to show kind of how they're trying to change practices. And that team continues to meet, not as frequently, because in addition to that, the team has moved to kind of a huddle type of model where every other week, a subset of the team is huddling to try to specifically solve problems in a collective, collaborative way with patients or people in the community that we know and who have signed releases so that organizations can share information. One other piece I would just want to elevate is, because this is, I think, an example of Bert Nash's excellence in sort of clinical education. You know, Aaron Newton and the team at the Access Center has worked very closely with Derek and I. We went and got trained to be national trainers in what's called LEAP, which is a process of communicating with people who have a serious mental illness, and they lack insight. They have a symptom called anosognosia with their mental illness. And Derek and Aaron and I have been training this LEAP process with our clinical teams out in the community. And there will be more opportunity to do that, just like Bert Nash is doing this outstanding job at mental health first aid. So I think the question is really good of how do we really intentionally continue to elevate that community education and education among our partners to understand this patient population and what, you know, an organization like Behavioral Health Partners is trying to assemble in terms of a new resource and a different type of resource in the community so that it's aligned.
Thank you both. It's helpful. And I don't have any other questions if other commissioners do.
I don't have any questions.
This is Commissioner Portillo. Sarah, do we have anyone at the courthouse for public comment on this item?
We do, and I just want to apologize. Eric, you can come forward while I'm getting this ready. This laptop is going to shut down here in a minute, so I'm trying to get another laptop stood up. So go ahead and have a seat, Eric. No, I think I'm okay. So I just want to warn him, if something happens, if you could just give us a moment till we can get reloaded, I'd appreciate it. But I just want to explain the technical difficulties. So
Appreciate the background.
Again, an address.
My name is Eric Hyde, 1605 West 27th Street, Lawrence, Kansas. Okay, Bert Nash affiliated with I did hear Heartland. I might have been mistaken about that one. Is a word I heard, the Heartland word. Law enforcement involved? No. Ambulance services only. Maybe some law enforcement, but only to strengthen ambulance services. I used to be a paramedic in Worth County EMS. It's a very easy 911 call for paramedics to provide services for mentally ill people that are suicidal, especially. You can have sort of a team like that, but not only police. You need to have the ambulance around. This is unintentional and intentional healthcare fraud. I can explain that more later. Recovery or more crisis. You're going to see an increase in recidivism. This is not multidisciplinary in terms of the care provided. I can prove that. This is not an expanded access of care. I can prove that. This project is rushed. 2018 is not a long time to plan a big project like this for being introduced. Peer healthcare specialists are trained to be conflicts of interest via Bert Nash specifically. Mobile response N to the O, N-O. You want to help so-called mentally ill? Don't do this. They are not qualified. Tell them, okay, my story is, in 2018, I returned from a 5-month film festival journey. I won awards. I'm a filmmaker. I was arrested illegally by the police who did illegal maneuvers. I wasn't smart enough and I was too distressed to challenge it at the time. I was coerced. So I decided to go to behavioral health court, who disregarded my traumatic brain injury completely. They put me on drugs that almost killed me. These are FDA approved drugs with side effects of suicidal intent. I'm not lying to you. I'm going to sue the FDA. And I'm also going to sue Bert Nash for completely disregarding my traumatic brain injury. I'm also going to sue Heartland Community Health Center for completely disregarding my traumatic brain injury and just treating me like I'm mentally ill. How dare they commit that healthcare fraud and almost kill me? All right, let's see here. I'm suing all those people. I did file a cease and desist order. It was either today, this morning, or yesterday morning against Bert Nash, the co-officers, the police co-officers, they have been harassing me because they think they know who I am because they can review my Bert Nash medical records, which are all fraudulent because they don't include my traumatic brain injury. And there are plenty of people in this community with traumatic brain injury. Do not do mobile response without more further review of this. This is a totalitarian Gestapo-like systematic approach to profit solely and via this project and its employees on so-called mentally ill individuals. Specific outcomes, behavioral health care, don't orchestrate more healthcare frauds via mass pharmaceutical malpractice, as I talked about before with the FDA, and via psychiatrists and via Bert Nash and blah, 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 whatever. Even the crisis team is probably going to do pharmaceuticals. I already talked about that. These drugs also, they cause suicidal intent, they cause severe depression. They make people want to kill themselves because they drug them up so much.
We really appreciate the public comment.
No.
We're a bit over
I'm
time. If
almost
you
done,
could
I'm
just
almost
wrap
done,
up.
So I will begin. The county commission has no right to do this and infringe on the civil liberties of these labeled people, and it is a complete discrimination and basically extortion from the public fund to further federally discriminate and commission healthcare fraud. This needs more review. Law enforcement involved in this conflict. I'm done. Thank you.
Thank you. Sarah, do we have anyone else at the courthouse for public comment?
We do not.
Jill, do we have anyone online for public comment?
No.
Okay, so we will bring this back to discussion from commissioners. Commissioners, do we have additional discussion?
I just want to voice my appreciation, Derek. You've been working on this quite a long time now. Also, my appreciation for not showing off your first place transformation trophy in the background. Appreciate that. But I do really think this is informing our crisis intervention, our crisis and recovery center. And that was a question I had. Thank you for that. Commissioner Portillo sort of got to that. And it's really helpful to see what you're learning from this that will inform that. And I think it would be great for you as we get closer to opening the crisis and recovery center to even give us maybe a larger overview of the things that we've learned along the way and how those things have informed the staffing that we're putting in. I am concerned about whether we'll have enough workforce in this. I think that's something we'll need to consider going forward. But I just wanted to take a moment and thank you, Derek, for all your work, and Jeanette and Patrick and Stephen for all your work on this, because I do think it's helping us try to serve our population, this really difficult to serve population better. So thank you.
Thank you.
This is Commissioner Reed here. I don't have any additional comments. Just want to appreciate that. I think it makes a lot of sense to me that this is a focus of work right now as we are building that crisis recovery center. I think it's a really necessary acknowledgement that there have been gaps in our community, and now is the time to start addressing them and figuring out what a bit of the kind of skeletal structure of things can look like. And I hope that will really translate well to opening up that crisis and recovery center in a pretty smooth fashion. So thank you all for the intentional work behind that.
This is Commissioner Portillo. If we don't have additional discussion, I can go ahead and make a motion to approve the community partner agreement to expand the Douglas County Integrated Crisis Team at a cost not to exceed $466,000.
Second.
All of those in favor, please say aye. Aye.
Aye.
Thank you all. Thank you so much for the presentation this evening. We appreciate it. And with that, we will move on to item 4 on our agenda, appointments. I think that we do have a Food Policy Council appointment to consider this evening. Do we feel comfortable moving forward on this? Fantastic. Let me pull up. So I believe that we are considering Mary Kirkendall. Mary is the founder of Eudora Giving Gardens, a dynamic community garden program that recently gained 501(c) status, where they host workshops, they provide produce donations, and have a CSA program. Any discussion around the recommendation of Mary Kirkendall?
I think we all met Mary last week, and I think she'd be an excellent addition to the Food Policy Council.
Yep, same. I think she's been doing really important grassroots work in Eudora, and so I'm excited to have that representation and see what kind of growth is possible. So grateful that she's willing to jump on another thing on the county level also. She's doing a lot of organizing and support work in Eudora specifically, and excited for her to translate that to some countywide food policy.
So Commissioner Portillo made that motion. I'll go ahead and second.
All of those in favor, please say aye. Aye.
Aye.
Fantastic. Do we have any additional appointments to consider?
Commissioners, I think Sarah, now Robin Crabtree, Sarah offered a list for us of possible planning commissioners, and I'd volunteer if it would be okay with the other commissioners to go through that list, make some phone calls, and bring someone to us for an appointment. If you all would feel comfortable with that. If you have specific things you're looking for, tonight might be a good time to share that with me, and if that's all right with you, if that's a good way to process this. It was sort of a large list, but with my background on the Planning Commission, I'd be happy to take that on.
This is Commissioner Portillo. Commissioner Kelly, I really appreciate you taking that on, given your background, having served on that commission. I think that you can give all of our potential candidates really solid background information of what they're stepping into. And I appreciate you bringing a recommendation to us when you're ready. I don't have any specifics as far as what we're looking for. Commissioner Reed?
I would echo all of those sentiments verbatim. I appreciate you making the offer, Commissioner Kelly, and that would be really helpful.
I would say that I think we're probably looking for someone who lives in the unincorporated area. I just want to confirm that with commissioners. I know we've had some discussions, maybe prior to the new commission that we have now, about just representation. I think that came up at our planning commissioner retreat earlier this year. And so I think, that's one thing that I'm really going to be looking for, and a nuanced understanding of the pressures out in the unincorporated area and how the city's policies are impacting those rural areas. And I'm not really looking for a right answer, just someone who really understands all the complexities of that challenge. So that's something I'll be asking people about.
This is Commissioner Portillo. I appreciate that. And given the recent discussions that we've had around rezoning and how do we make sure that we're adhering to our 2040 plan and really thinking through what our values are there, I think that having a voice from the unincorporated area to really raise those questions on the Planning Commission throughout those conversations will be important.
Yeah, I think you're spot on, and I was just going to pull up that list again, but I think that list read to me as pretty thoroughly individuals from the unincorporated area. And I did wonder, Commissioner Kelly, or maybe Sarah, how much representation we have like that on the Planning Commission as it stands. Maybe we don't know that top of hand.
I know we have a few, but I also know we have several that are planning to leave, or just their terms are ending.
That are coming to an end.
So
Okay.
There's a little bit of succession planning involved in this process.
Okay, great. Well, thanks again, Commissioner Kelly.
Yeah, and just to follow up, I think that was something that the Planning Commission asked for, was even more rural representation. So I think we're being responsive to them asking for that perspective to be added to the commission. I don't have anything else for appointments. Thank you.
Thank you, Commissioner Kelly. Commissioner Reed, do you have anything else for appointments? Okay, then we will move on to miscellaneous. Sarah, what do you have for us this evening?
Thanks, commissioners, and I appreciate you. This has been a series of unfortunate events for my technology here this afternoon. I can't even blame technology. I left my laptop at home. So we've been trying to make all that work for me, and I really appreciate Robin's help. You do have an updated packet memo from me in the packet. I did add a couple of calendar items that I know we have had some conversation about, but I wanted to highlight that we are planning on our first drug court graduation for May 14th. I would say that I don't believe all of them in the future will be scheduled at the Lawrence Arts Center. We did want to make sure we had a large enough venue for this first event and make sure that we could maintain social distancing. So, I think there's a lot of folks that are really excited to see this project come to fruition. So that's on the agenda. Also, all the commissioners were invited to the 2021 Farm Bureau Legislative Dinner. If you all plan to attend, just let us, or if we have more than one of you there, let us know so that we can notice that event. And I wanted to highlight that, on May 7th, our Mike Brower, our criminal justice coordinator, is going to be featured on a Council of State Governments Justice Center Congressional Hill briefing related to how 3 different communities are supporting mental health and decreasing justice system involvement through the Justice and Mental Health Collaboration Program. So we're excited about that kind of recognition. And then next, and then you see the upcoming work sessions we have related to mobile access team and the tax system coming up. And I just want to begin to alert commissioners and the public. There are 5 Wednesdays in June. So my recommendation is that we do not meet on June 2nd as a recognition of that 5th meeting. And so if there's any concerns with that, please let me know ASAP. That's all I have. Thank you.
This is Commissioner Portillo. Are there any miscellaneous items from other commissioners?
Maybe just a quick share out a couple things. One, I want to congratulate Shannon Oury, who won the Pioneer Award from Burton. Excuse me, got choked up there, from Burton Ash on Tuesday, and some really well-deserving winners from Burton Ash who have served our community. It was a little different presentation, but it was fun to watch, and we work very closely with Shannon as a partner, so that's great to celebrate her. And then also we had the final mass vaccination clinic today. Lots of press was there. That was sort of surprising to me, but I think it was really something really great to celebrate and know that this is the end of a chapter as we move on to push for more vaccination across our community.
This is Commissioner Reed here. I will just share that today I got to join a pretty large national call with, I think it was 21 counties maybe, for the Stepping Up initiative, which is doing a set, measure, achieve community of practice. Of course, it's governments love a million extra acronyms. Making myself keys, like little notebook keys of all the acronyms. But I was invited by Mike Brower to join that team that's already done a tremendous amount of work to reduce the number of people experiencing severe mental illness who are booked into our jail and how long they're staying in our jail, and also assessing what kind of services they're being connected to if and when they are booked into our jail. So it was the first of 4 meetings, I believe, that will take place this year among counties to report out how that data is being determined and measured, and if we're meeting our goals. So I'm excited about doing that work. And I think that Douglas County, in our kind of report out of what we're doing, it has done some impressive work so far, and we've got some good baseline to work on. And it looks like there's one area that we don't have great baseline data on yet, and excited to be a part of digging into that and figuring out how we track our connection to care for people who are booked into the jail, and what those referrals are looking like, and how do we see people moving through different systems in the community. So I'll keep you all informed as that moves forward.
This is Commissioner Portillo. Thank you for taking that on, Commissioner Reed. I'm excited to see how that project moves. We do know that the Kansas legislature is coming back for their veto sessions starting on Monday. So I'm hopeful that we will start to get some of those legislative updates again. I am fearful that this will be a long veto session for us, but we will see what happens. Just something for folks to keep an eye out for. Do we have anything else for the good of the county?
Not today.
Okay, then I'll say let's go ahead and adjourn for the evening.
Have a good night.